I'm the mother of a 13-year-old son named Devin. I am also the current chairperson of the Family Advisory Council at Children's Hospital, and I have been involved with the council for over 11 years. Through the council, I've met many families who have a similar story as mine. 13 years ago, my son was born with a very complex chromosome disorder. He is missing 45 genes on chromosome 4 and has an extra 30 genes on chromosome 6. Devin has had over 17 medical conditions involving all organ systems. This has required over 40 surgeries and procedures and double that of hospitalizations, all at Children's. He sees over a dozen pediatric specialists who have all been able to treat his unique needs. All of his care has been coordinated and family-centered, which is something that Children's values with all of its families and patients. We are currently treating a virus in his bone marrow and a deficiency in his immune system. He's getting IVIG infusions on a regular basis. He also had a brain aneurysm repaired a few years ago and needs to have annual testing to be sure that that aneurysm continues to be stable. He also receives genetic testing to be able to pinpoint potential problems before he even starts to have symptoms. If Children's could no longer provide this care for him, I am not certain that he would survive. This aneurysm could return and prove to be fatal, or his immune system could fail to respond to common infections. I have my son today because of the excellent care at Children's. Through outpatient rehab clinics, he has learned to walk, to communicate, to eat table foods, and be no longer dependent on his feeding tube. He goes to school, performs in music, plays, and loves every minute of it. But I worry about my son. What if he gets sick? What if his bleeding disorder becomes too much to handle? What if he has difficulty with his respiratory condition? But I am always instantly reassured that Children's is just a few miles away, where he can get the medical care that he needs. There are hundreds, if not thousands, of families in this state who have depended on the specialty care that Children's provides when their child needs urgent medical attention like my little Devin. Children's has never given up on my son. I certainly have never given up on my son. And I hope at the end of the day that our lawmakers won't give up either. I might hear one day that there's nothing more that we can do for Devin. And as hard as that sounds, I will somehow have to accept that. However, if the statement starts with because of budget cuts, there's nothing more we can do for Devin. And I'm not sure I'll be able to accept that. I see things as a wall going up between my son and the care he needs. Every time there's a cut to Medicare funding, every time a service or prescription is being denied, every time complex regulation, policy, and restrictions are put into place, that wall continues to rise to the point that the care my son needs may no longer be available. My son and I are caught in a never-ending circle. He gets sick, he misses days of school, I am unable to go to work. And if we can access the best pediatric, effective, high-quality, safe care that Children's can provide, then he can recover, return to school, and I can return to work without being emotionally and financially ruined. I know these are tough times. Difficult decisions will need to be made. But I urge you to make decisions about healthcare reform that will protect the care that my son will continue to need, and ensure that his health and the health of all children will be valued and protected under any new healthcare system.